going over some medications used in ADHD treatment. It ranges from stimulants such as methylphenidates and amphetamines to alpha-2 agonists such as guanfacine and clonidine, and then your norepinephrine reuptake inhibitor like atomoxetine, and then you got your buproprion and other certain antidepressants. So let's just get into it. So ADHD, it's characterized by three symptoms, which is hyperactivity, inattentiveness, and impulsivity. Um, I feel like a lot of people kind of have a general understanding of what ADHD is like. So there is something called the DSM-5 criteria, which is used to diagnose it. I'm just gonna kind of give you the too long didn't read version. So basically, one of the criteria is presented with like the hallmarks symptoms for at least 6 months. So the hyperactivity, inattentiveness, and impulsivity. You got the symptoms which were present before 12 years of age, but there is some evidence that it can occur later in young adults as well. So this one's not too strong of a criteria. And then another one is it occurred in two or more settings. So not just at home, it can occur in the workplace or at school as well. Affects your quality of life, so basically your social life and schoolwork. Um, and it's not caused by some other underlying disorders like schizophrenia or like mania disorder from bipolar. Um, Typically, pharmacological treatment is usually given only if the patient is about 6 years or older. If they're less than 6 years old, then we want to give cognitive behavioral therapy and other non pharmacological therapies. And pretty much all the therapies that we're going to talk about today, like the medications, pretty much all of them reduce the seizure threshold and will affect the CV system in some way. So let's get into the bread and butter, which is just stimulants. So there's two classes. There's amphetamine based and methylphenidate based. So that's basically Adderall versus Ritalin. So the only two, basically the difference between these two classes is basically that only amphetamines are affected by like pH products. So acidifying products like vitamin C will decrease absorption and increase elimination, while alkalizing products like sodium bicarbonate will increase its absorption and decrease elimination. The only exception will probably be your Vyvanse, which is lisdexamfetamine, because it's a prodrug. So the only thing that's affected is elimination only, not the absorption. And methylphenidates are not affected by any pH changes at all. So long-acting stimulants are first line. So you've got your lisdexamfetamine, Vyvanse, which is about 13 hours, so 10 to 12 hours. Methylphenidates, controlled release. So your examples would be Foquest, which goes at 16 hours. Bifenton, which is about 12 hours, and Concerta, which is about 12 hours as well. And then you also got your mixed amphetamines, which is your Adderall XR in 12 hours. Probably the easiest way to remember these ones is if you can learn the brand names as well. Okay, and then intermediate or short acting, usually these will have IR in the name for instant release. Those are pretty much just given as adjunct, or if a patient wants a more flexible dosing schedule, mostly because the duration of an action is about like maybe 3 to 4 hours or 8 hours. Anything with a capsule formulation can be opened and sprinkled in soft food for those with swallowing difficulties. So, for example, that's pretty much your Foquest, your Bifenton, your Vyvanse, Adderall XR. Dexter Spaniels may also be sprinkled. Just a note, Vyvanse can also be sprinkled into water, but like again, as I said, you don't want to mix it with some kind of juice, like orange juice, because that acidity um, would oh my gosh, why am I losing my train of thought here? It would increase your elimination, um, but it won't be affected by absorption. Methylphenidate instant release tablets can also be crushed, while amphetamine instant release tablets cannot. And then also Concerta has a special formulation which uses something called osmotic pressure. And the reason I'm mentioning it is because in certain conditions you want to avoid certain gut disorders like short gut syndrome because the tablet will not dissolve. And that's why you usually counsel the patient that the tablet you'll see in the feces because it gets excreted in the feces. Okay, so now for the adverse drug reactions and contraindications. So because it works on the dopamine pathway, um, you have to be careful in substance abuse, substance and drug abuse. And then also from moderate to severe hypertension with the high CVD risk. And then also when you use a MOA, so that can lead to the hypersensitivity crisis. So usually with MOAs, it's generally recommended to maybe do it maybe at least 14 days after, because that's when it's usually fully out of the system. And then also uncontrolled hyperthyroidism, and that's just more towards a hypertensive crisis, because when you have hyperthyroidism, your metabolism is in overdrive, and that can also lead to increased heart rate and tachycardia. Okay, and so these are pretty much the most common adverse drug reactions. So I think the best way I can describe this is if you kind of look at the color scheme. I did blue for transient effects, so these will go away after a week. So this will include like your headaches and dizziness, a bit of the weight loss, um, because patients will get appetite suppression. So what you usually need to counsel patients on is you need to either take the medication after food and you need to get the patient to maximize their nutrition as well. And that's not too bad with young adults, but the problem is with kids as well. So with kids, that's why you need to kind of maximize the nutrition and watch their diet, make sure they're eating properly as well. And another thing is to avoid an anorexia and other eating disorders, because that'll just make it worse. Because these patients generally already have trouble eating as it is. And then the irritability will usually go away as well. And then one thing to note about insomnia, that can be avoided if you give the last dose just before 4 p.m. And you just want to just watch out for the suicidal ideation. And then if you see these ones, you want the ones in red. Usually you want to stop this medication. And I also added zombie-like effects or rebound hyperactivity. So let's just kind of just delve into that. So the increased blood pressure and heart rate. So you want to stop that because if there's a significant change, so basically a change of about 4 to 6 higher in blood pressure or maybe 5 to beats higher for heart rate, which can indicate the presence of a tachycardia as well. Appetite suppression is not too much of a red flag. I just kind of put it there to kind of correlate with the anorexia because, like I said, it'll just make the symptoms even worse. And then, of course, you've got the decreased seizure threshold as well. Glaucoma is another one, but uh, I think it's not too much of a common side effect, but it's just there for completeness as well. And then one last thing is just the unmasking or exasperation of tics. So in that case, you can still use stimulant therapy, but most of the time it's usually preferred to change it to something more preferable like atomoxetine. And then of course you got your overdose symptoms, which is going to be like your glassy eyes. So patients will usually have like this kind of blank stare, but their eyes look kind of shiny and glassy. And then of course you got the insomnia because remember stimulants stimulating your system and the hyperactivity. And then of course the big one here is seizures. So one way I kind of remember this is the mnemonic is just high school and secondary school because whenever you kind of always hear whenever I personally hear stimulants, I always kind of associate it with school. And so if you kind of remember high school and secondary school, you can always kind of remember, high blood pressure and heart rate, which can lead to CV risk. So when you're at school, it can be really stressful, like you're studying a lot and you're trying to get those good grades. Another is like body dysmorphia as well in high school and maybe in secondary school as well. So you get kind of skinny. So there's the appetite suppression. And then substance abuse because it works on the reward pathway of dopamine. I don't know why. There's always like that one group of students who would sell drugs and stuff. I don't know. I don't know if it's the same for other schools, but it's kind of just always been in my head. And then also seizures as well, lower threshold. Um, Not much else to say for that. Like maybe when you're just studying too much and then you just feel like your brain's gonna explode, kind of like that. But usually that's what I kind of think of. Just think of like you always kind of just associate these medications with helping you focus in school. So if you kind of remember that, you kind of remember like, oh, okay, the high blood pressure and heart rate and the skinny and the substance abuse and seizures as well. And that's just to kind of do with the beginning of each letter, which was the S's and the high. So pretty much you should see effects within 1 to 2 weeks, and you want to trial these stimulants for at least 3 to 4 weeks before you switch to another therapy. And then there's also the case of drug holidays. There's mixed research that stimulants can retard growth. And so that's what these usually drug holidays are for, is to kind of help with the growth. It's kind of mixed evidence at the moment, but basically it's done by a case by case basis. So not everybody that's on stimulants have to do drug holidays. It's just a time where you want to reassess if they actually need it. And you usually want to do it during low stress. So basically something like summer vacation. And so these drugs are usually tapered for a 2 to 3 week drug free period per year. And the need for therapy is reassessed. You usually don't want to stop these medications abruptly, and they need to be tapered. Usually, they're usually tapered over at least 6 to 7 weeks. All right, so we got our alpha 2 agonists. So we got our guanfacine, which is also known as atunev. You'll usually see this more second line, and then you see clonidine, which tends to be more third line in treatment. So these are more to target the hyperactive symptoms. So this is more like the aggression, the impulsivity, the sleep disruptions. And just an important note is that guanfacine, in Canada, anyways, it's only used between the ages of 6 to 17, where the other ones are used any age older than 6. But of course, the doses are gonna adjust according to that. But guanfacine, don't usually use it above past 17. So these are good for patients with substance abuse or oppositional defiant disorder or a history of psychosis. It's also good if tics are present as well. It takes about 2 weeks for these drugs to work, and they tend to work more on cardiac, as you can see, alpha 2 agonists. They work more on the cardiac effects. If patient wishes to stop therapy, then the drug has to be tapered. So let's get into the side effects. So we'll start off with guanfacine. And oh, okay, clonidine came up as well. I highlighted the ones in red that you kind of just need to know, which is you got your drowsiness basically. Drowsiness also leads to kind of like dizziness as well. You got the bradycardia and hypotension. So if you got the hypotension, don't forget about orthostatic hypotension, which is when you get up too quickly and you get that dizziness, which also goes hand in hand with the dizziness. QT prolongation. I hardly ever see this one in QT prolongation questions, so you might not see it that much. But also decrease the seizure threshold. So these ones also decrease the seizure threshold as well. And clonidine also causes dry mouth as well. But don't know any other anticholinergic effects except the sedation as well. So this is our norepinephrine reuptake inhibitor, also known as atomoxetine. I included the name there, Strattera, which is the brand name. And you tend to use these just like the alpha 2 agonists, it's just like the hyperactive symptoms. And usually it's kind of reserved as second line or adjunct or first line if psychosis is present. And it's usually preferred if tics or Tourette's syndrome is present. I think I mentioned that earlier as well. And kind of due to less potential for abuse because it's not working on that reward pathway, the dopamine reward pathway. It's also preferred in patients who have a history of drug or substance abuse. It's also worth to note it's associated with less withdrawal as well. Um, Contraindications, probably the MOA is probably the big one you need to know because of that hypertensive crisis. And some other adverse drug reactions, it is a substrate, so you need to watch out for that. And it does cause headaches, sedation, dizziness, rhinorrhea, increased heart rate and blood pressure, and decreased seizure threshold as well, and QT prolonged. Okay, so now we got buproprion. So this one you won't really see too much in ADHD treatment unless depression is present. There's also notable other antidepressants that may be used, such as your TCAs. So that's like your amitriptyline and your venlafaxine. So it's known as an atypical antidepressant because it blocks dopamine and norepinephrine reuptake, where most of the other ones will usually affect serotonin in some way. And depression usually takes about 2 to 4 weeks to work, and you should avoid in patients with substance abuse, and that's because, again, it works on that dopamine pathway. So the adverse drug reactions, kind of way to remember it is the four S's, which is seizures, lowers seizures threshold, especially in doses above 300 milligrams. And sex, it's great for patients experiencing sexual dysfunction with other antidepressants, notables like sertraline, for example. And smoking can also be used in smoking cessation. And skinny, which causes appetite suppression leading to weight loss. So you want to avoid an anorexia or other eating disorders. I guess this wouldn't be more like adverse drug reactions, but I think it's more like important points to know. So I'm going to just cross that out there. And then other adverse drug reactions to know is it is a CYP2D6 inhibitor. So for example, you want to be careful with what's in medications that's like a substrate, something like codeine, for example. And then you got your tachycardia and dry mouth as well. And that pretty much sums up all the ADHD medications. And so, yeah, I hope that kind of helps you study for your exams. And hope you guys do well. Thanks.